Hi everyone, Dr. Jen Pamer here. Did you know that ear infections account for 30 million visits to the pediatrician every single year here in America? Often with those visits, we will get a prescription for an antibiotic. Research is already showing us, and doctors are now experiencing, the results of the effects of those antibiotics. With every continued exposure to antibiotic, your child is at risk for asthma, allergies, things like IBS, and recurrent ear infections. So I want to give you some tips today on how to help your little ones through the cold season, and well, yourself even, because we do know the flu and cold and all kinds of stuff is going around this time of year. First thing we want to talk about is sinuses. You know, a lot of the ear infections come from just a buildup of sinuses and the inability to drain through your little one's ears. So we want to try to eliminate as much sinus or mucus production as possible. First thing that you can do is avoid dairy. A lot of people are sensitive to dairy and it does increase mucus production. Colloidal silver, this is one that a lot of people don't know about. It has natural antiviral properties. You can take it by mouth, by drop. It's also very safe for your children to take. Elderberry extract, you just want to be careful with the elderberry if it does have honey in it, that you do not want to give that to your child before the age of 2 years old. However, if there is no honey, it is completely safe and very beneficial in just helping the immune system before onset of cold and even during onset of cold. Zinc often goes under or gets overlooked as well. It is a mineral that is extremely important in your immune function, and we are often very deficient of it, as well as vitamin D3, especially in the winter time here in Ohio, where we just really don't see the sun for days and days and days. So those are things that you can supplement throughout the winter, whether your child is ill or not. The colloidal silver being one that you really only want to do for a couple of weeks at a time. It's not something that you want to do ongoing day in and day out. You can also increase levels of vitamin D during or throughout the duration of a cold. So a higher dosage, anywhere from 5 to 7 days while you or your child has a cold. They also make suction cups or straws, if you will, for sinuses, which is really, really gross, but it does help draw out that mucus production or the mucus that's stuck up there in those sinuses to help your little one. And one of the biggest things, I just had patients literally earlier this afternoon come in out of their normal routine because their child was sick and they knew that getting adjusted again would help, number one, boost their immune function. Research has proven that there is a direct influence on the immune system when you get adjusted. And number two, it does help the angle of the tubes in a little baby's ears to come down a little bit so that the mucus or whatever can drain. So as we're developing as little babies, our tubes are horizontal, and as we grow to adults, then they go like this, and it can drain more easily. There is a close relationship to that tube and the C1, or your atlas, the top vertebra in your spine, and if that gets out of place or what's called subluxated, it can keep that tube from draining. So that's often one thing that we look at is that C1 vertebra in our little ones with those earaches. So hope that helps. Hope you have a healthy, happy season. Enjoy the rest of winter. Spring will be here before you know it.